My name is Dr. Golnush Hakimdavar, and I am very excited to have Dr. Massumi with us here today. Dr. Massumi is a board-certified specialist in physical medicine and rehabilitation. He is a fellow at the American Academy of Physical Medicine and Rehabilitation and a diplomat of the American Academy of Pain Management. He's been named by Baltimore Magazine as one of the metropolitan area's top docs. I'm really excited to speak with him about something that we are all concerned about, which is COVID-19, the coronavirus, and its effect on the community. I have some questions for Dr. Massumi, so thank you so much for being with us.
My pleasure. Thank you for having me.
Of course. So going into the first question that I had was whether you have seen that individuals with chronic pain are at risk of not receiving appropriate treatment because of COVID-19 and clinic closures or doctors being overwhelmed with the number of patients. I know you are yourself at the office right now, but is that something of concern at this point?
Well, no doubt about it. It's been a major logistical issue. We are fully compliant with the orders of the governor and the state of Maryland, so we haven't actually had any patients come to our clinic. Luckily, this major cataclysm has been coincident in time with the availability of online services, and we have put that to good use. We are now able to basically be in touch with our patients, communicate with them in an audiovisual stance, and thanks to the understanding both of the CMS, Centers for Medicare Services, and most of the other carriers of third-party coverage, they are now accepting for a period of time a lot of our services on a telemedical or telehealth basis. So as far as my particular established patients are concerned, we have not had any issues with the continuity of service to them. Now, there may be clinics that do not have the availability of telehealth or telemedicine yet, but I know they're ramping up and trying to get on board very quickly. Most of the services are cloud-based, so it's easy to implement. I haven't heard from my colleagues in my field that access to medications and refills has been an issue yet.
Right. Well, that's really good to know. The last statistics that I checked, I think we are at about 200,000 cases of COVID-19 in the U.S. and many, as we know, many individuals will recover from this illness. But do we know if COVID-19 has any causes any chronic pain, has any long-term side effects that we should be concerned about?
Well, obviously, it's kind of early about that. COVID-19 really started in December in China. That's only a very few short months. But the impact it has, the impact of this virus on the human organ system is significant. And it results in something that is commonly known as a cytokine storm, so a vigorous immune response, which in turn can turn against the body and destroy organ systems outside of the pulmonary structure. So yes, there is a good possibility that in the longer short term and the longer long term, we are going to see issues in these patients with their neuromuscular or musculoskeletal system, the two areas that I'm particularly involved in. I wouldn't be surprised, but it is kind of early to ascertain that because the disease is novel and its impact is new. And it obviously, in the cases which have resulted in demise, it is because of multi-organ failure and hypoxemia. Those changes themselves can also impact the neuromuscular system very significantly, and that may not be evident right off the bat. But I would expect that we will have some things to deal with in the future few months, into the future year or two, from COVID-19, which are not exactly related to the acute stage, yes.
So as you're telling us, it's something of concern for long term, and we need to just stay aware of it. Now, knowing that we're all working from home, many individuals are in quarantine, many are in isolation if they have been diagnosed. Have you seen a rise in self-medication due to this extensive isolation and periods of kind of quarantine?
That's also a very appropriate question, meaning that if a patient is not in the company of family, friends, mentors, and advisors, would they be harming themselves by reaching for drugs when they normally wouldn't reach for it because of the circumstances they find themselves in? So that's a very valid question. I haven't seen it in my patients because my patient population is predominantly elderly, and they're sensible and they're very cautious. However, it certainly can be a problem in the patients who may have chronic pain as an attribute not just of musculoskeletal disorders, but also of substance abuse disorders. They may be the ones that can get in much more significant trouble. I don't have hardly any of those patients. Most of mine are neuromuscular and musculoskeletal pathologies. Now, having said that, it is something to think about. As you may or may not know, when you prescribe potent controlled substances, there are many rules and regulations that govern that, and there are many ways that we can keep tab on its use through databases. For example, prescription monitoring programs and so on. So it's not as readily easy for a patient to either overdo it or to seek out medications, particularly of those categories. So I haven't seen it as a problem yet. It theoretically could be. It's probably going to affect the people who have a tendency to abuse drugs in the first place.
Have there been any changes in the way that medications are distributed because of COVID-19? Have you?
You mean have they eased the methodologies of prescriptions and so on? Well, most physicians nowadays have access to either prescriptions online using different softwares that integrate either with their EMR or standalone, or they fax them in most cases. If there are controlled substances, online services allow you to do that. So no, I don't think prescribing the medicine is an issue. The issue is whether the patient can get to that medicine on a timely basis. The pharmacies have now established over the last few weeks improved delivery services, and they're delivering to the doorstep. They're not taking it inside. The insurance companies are now allowing delivery without signature, so if the patient does not wish to step out and be exposed for a short period of time, that should be okay. I'm sure these can be abused eventually, but it won't be very long term. So I have not heard through the societies that we deal with in medicine, or through the Board of Medicine, or through the Maryland Department of Health, that this has become an issue yet.
And I know you yourself, I know you're in the office, but you're using telemedicine in order to connect with your patients. So has telemedicine changed how drugs are prescribed, or how are there any new guidelines by Drug Enforcement Administration that patients should be aware of?
Not so much for the patients, no, because the responsible parties are the prescribing providers, and those are usually physicians, nurse practitioners, or physician assistants. The guidelines remain strict for controlled substances. They may have eased them a little bit in terms of the mechanism by which you deliver the prescription. In case you're, if you were writing them by hand, maybe you can now fax it and then send it in the mail to be received by the pharmacist, for example, if you're still in that mode. In terms of how has telemedical, or rather online communications, eased matters tremendously. Thankfully, it has allowed us to either have an audio or audio-video communication with the patient and reassure them that they are going to get their refills on time. And then we can also review with our patients online alternatives to a given category of medicine if the one category is not available or in short supply. So we can review with them the characteristics by looking at the website, et cetera, et cetera. So the online educational influence of telemedical or telehealth connections is helpful. And the last point the other point in your question was, how about payment for services and mechanisms for recognition of this as a medical service? That has been eased for a short period of time, probably for the next month or two, so that historically you could do telemedical services to a distinct telemedicine remote site. Now you can do it directly to the patient at the point of service. That will be in their home, or if they're in a, let's say, a nursing home, you can communicate with them using standard encryption platforms such as Zoom, or such as even Google Meet and so on. And they are now allowing that for a short period of time to be the case, which has eased the worry, anxiety, and burden both on the patients and on the providers.
That's good to know. I'm sure it helps many of the patients kind of ease their mind as they continue to need assistance. Do you have any advice for us in the community on what we should do, how we should protect ourselves, and how we should just stay healthy?
Definitely. I mean, the advice we're receiving from our authorities is correct. The advice we receive from CDC is obviously correct. It is common sense. We just need to abide by it. I think the trouble we have in a federated system of government is that the states have some leeway, and they have been basically not all synchronized in their response to the public health measures they can take. So the public health measures are obviously the sheltering in, the self-distancing, the cleansing of the hands, and so on and so forth. Is there any prophylactic methodology? Not that I know of. There was a lot of buzz about a number of chemicals you may have heard about, some antibiotics, some anti-malarial agents, so on. I don't think that has been proven. Clinical trials are going on actively. You can go to clinicaltrials.gov and look up many of them, but they're not going to have reports to provide for us. So the most important thing right now is self-distancing, basically sheltering in, watching the compounds and the food products that you buy. Make sure you disinfect the packaging and so on before you open it, and just be sensible about it. Now, the symptoms to watch out for are the fever, the cough, and the shortness of breath, principally. And CDC has multiple different sections on its website for the lay public what to be on the lookout for. So I will refer you to that. And your state Department of Health have also multiple different resources that you can look up. So if you're getting those symptoms and you're worried about it, the first thing to do is to contact a physician, your physician or the immediate care physicians available. I wouldn't go to the emergency room, and discuss with them your symptoms. There are some testing centers where the public can go to and be tested by properly outfitted professionals. And the test turnaround time is improving. I understand that some companies like Abbott have devices now that can do the testing in a matter of minutes. So things are getting better. We just need to hang in there and exercise more of the self-distancing and sheltering in.
I really appreciate you taking the time to speak with me. I know it's a busy time for you, but we really need the support and the information that you provided. So I really appreciate it. Thank you so much.
My pleasure. And I just want to reassure everybody that the medical profession and my colleagues were very much on this, but we would like to request from the public at large to pay attention and take heed to the recommendations that are coming from the authorities. It is serious.
Absolutely. Yeah. Thank you for